Assalamualaikum warahmatullahi wabarakatuh. Hi, my name is Anggurwati from PSIK 5A. Here I will explain the medical issue about leprosy. Definition of leprosy. Leprosy is a disease caused by Mycobacterium leprae, which attack the skin and peripheral nerve issue as well as the eyes and membrane lining in the inside of the nose. WHO classification leprosy into two groups, namely paucibacillary. This type of leprosy causes a clear sense of numbness and attack one nerve brains. Multibacillary. Multibacillary leprosy, unlike palibacillary, indistinct numbness and attack many nerve brains. There are several factors that can increase the risk of leprosy. For example, having genetic disorder in the immune system, physical contact with animals that spread leprosy such as armadillos or living in leprosy endemic area. Cause of leprosy. Leprosy is caused by the bacteria Mycobacterium leprae, a type of bacteria that grows slowly. Leprosy can be transmitted through prolonged and close skin contact with the person who has it. In addition, leprosy can also be transmitted through inhalation, breathing air. The reason is that the bacteria that cause leprosy can live for several days in the form of droplets in the air. However, leprosy is not an easy disease to spread. The thing to note is that leprosy can also be transmitted through direct contact with certain animals, such as armadillos. Leprosy requires a fairly long incubation time between 40 days to 40 years. On average, it takes 3 or 5 years after infection for symptoms to appear. Symptoms of leprosy. The main symptoms of leprosy are white discolored patches and lump-shaped skin lesions that don't go away after a few weeks or more. The lesion also accompanied by symptoms of numbness in area and muscle weakness. Leprosy can also cause other skin symptoms. This condition depends on the growth of the bacteria itself, and the types of leprosy will affect how we treat it. Tuberculosis, lepromatous, and then borderline. Leprosy diagnosis. The doctor can request the following examination. Bacterioscopic examination is made from scrapings of skin tissue in several places. Examination under a microscope to see the presence of leprosy bacteria. Histopathological examination aims to see tissue change due of infection. Serological examination is based on the formation of antibody in a person's body due to infection. Apart from identifying their main site, numbskin lesion, thickening of the peripheral nerve, and the positive bacterioscopic result, the doctor can make diagnosis. Complication of leprosy. Leprosy that is not treated quickly and effectively can cause various complications. Example, blindness or glaucoma, kidney failure, inability to fly leg. Permanent damage to nerve outside the brain and spinal cord. Progressive deformity or permanent damage to the begin nose, eyebrow, or tooth. Erectile dysfunction and infertility in men. Leprosy treatment. The main goal of leprosy treatment is to break the chains of transmission, reduce the incidence of the disease, treat and cure people with leprosy, and prevent disability, so that patients can recover and prevent resistant leprosy. Treatment use a combination of several antibiotics. People with leprosy are given a combination of antibiotics for 6 months to 2 years. The type of antibiotic, diagnosis, and duration of use are determined based on the type of leprosy. The treatment of leprosy is not only through drugs. Handling of the disease can also be through surgery. The objective of the surgical procedure for people with leprosy are normalize the function of damaged nerve, improve the body shapes of people with disabilities, restore limb function, prevention of leprosy. There are several efforts that can be done to prevent leprosy, including education about leprosy, especially in endemic area, perform early diagnosis and treatment to prevent transmission. Until now, there is no vaccine. Thank you.